Hi, thank you for joining us on the ACEP Capital Minute, a biweekly look at the latest developments from the nation's capital that impact emergency physicians. I'm Laura Wister. After my update, we'll open it up for questions. You can submit them at any time by using the Q&A feature at the bottom of your screen in Zoom, and then I'll answer them live. So today we'll cover in our legislative update, bills on the Medicare pay cut delay and ED violence, hearings on addiction and mental health, and then in our regulatory update, surprise billing listening session, PPE guidance, the pause on the J&J vaccine, tax relief for PRF recipients, and more. First, we'll discuss the status of several ACEP-supported bills and some important regulatory changes in the works. Last week, the House gave final approval that allowed for passage into law for an ACEP-supported bill that extends the 2% Medicare physician reimbursement moratorium through the end of the year by a vote of 384 to 38. A previous version of the legislation also included a waiver of the statutory pay-go requirement to avoid the additional 4% cut that will be implemented at the beginning of next year without congressional action. Unfortunately, the Senate removed that provision from the version that the House ultimately passed and that President Biden signed into law last Wednesday. Last week, the House voted to approve the ACEP-supported Workplace Violence Prevention for Healthcare and Social Service Workers Act, H.R. 1195, which is sponsored by Representative Joe Courtney of Connecticut, among others. The vote passed by a vote of 254 to 166. All Democrats and 38 Republicans supported the measure. The legislation directs the Occupational Safety and Health Administration, or OSHA, to require employers to establish workplace violence prevention standards and plans to protect emergency physicians, nurses, and other healthcare workers from violence and assaults at work. At this time, it's unclear when or if the Senate will consider H.R. 1195. ACEP and our contribution to the bill's development, as well as our endorsement of it, was referenced multiple times during the congressional debate last week. To read ACEP's letter of support, visit the link on your screen. It was a busy week of hearings last week on ACEP priority issues. Last Wednesday, ACEP member and emergency physician Tim Westlake testified before the House Energy and Commerce Health Subcommittee at a legislative hearing on addiction, which included discussion of the ACEP-supported Mainstreaming Addiction Treatment Act of 2021. This bill would eliminate the DEA-X waiver to prescribe buprenorphine to patients for maintenance treatment or detoxification treatment. The hearing focused on 11 bills in total related to the federal response to addiction, and the legislative proposals discussed were related to substance use, including prescriber practices and training, access to care, and the Controlled Substances Act, with specific emphasis on fentanyl and fentanyl-related substances. Witnesses included experts from the legal community, the acting director of White House Drug Control Policy, and others. The next day, the House Education and Labor's Health, Employment, and Labor Subcommittee held a hearing focused on mental health coverage and insurance plan parity. While the insurance industry continues to try to limit coverage for Americans who rely on their services, ACEP will continue to advocate for emergency patients who deserve adequate coverage for necessary care. Also last week, a subcommittee of House Appropriations held a hearing to examine the Biden administration's budget request for the coming fiscal year. It was notable that Representative Andy Harris, an anesthesiologist, asked Secretary Becerra if he would pledge to ensure the proposed rule related to the No Surprises Act on surprise medical bills would provide sufficient time for stakeholders to comment on the law. While Secretary Becerra did not explicitly make that commitment, he did state that HHS would take in all the comments necessary to hear from all stakeholders and guarantee that the department will go through a robust process to develop the rule. Also last Thursday, the Senate Finance Committee held a hearing to consider the nomination of Andrea Joan Palm to be Deputy Secretary of Health and Human Services and Chiquita Brooks-LaSure to be Administrator of the Centers for Medicare and Medicaid Services, or CMS. The nominees received strong support from Democratic members who secured commitments from the nominees to work with Congress on a public health insurance option, overcoming healthcare disparities, and lowering drug prices. There was bipartisan support for efforts to lower drug prices and expand and make permanent telehealth and other pandemic benefits. Republican members raised concerns, though, about the long-term stability of the Medicare program and highlighted the importance of supporting innovation to improve patient care and ensuring state flexibility. No Republican members expressed explicit support or dissent for the nominations. Late yesterday, though, Senator John Cornyn from the Republican Senate in Texas placed a hold on Ms. Brooks-LaSure's nomination in return for the administration canceling the state of Texas's Medicaid waiver late last week. ACEP joined more than 20 groups urging support for Representative Cindy Axne and Neil Dunn's efforts to reintroduce the Eliminating the Provider Relief Fund Tax Penalties Act, or H.R. 2079. This bill would ensure that assistance received through the Provider Relief Fund is not taxable. Removing the tax burden from these funds, meant to help ease the strain on emergency physicians and other health professionals, will help ensure a more timely recovery from the financial strain of the pandemic. Federal regulatory agencies have been eager to listen to ACEP concerns about our priority issues and continue to make changes with ACEP input that make a difference in your livelihood and your patient care. ACEP and EDPMA participated in a listening session last week with the 3 federal agencies charged with implementing the No Surprises Act, the Departments of Labor, Treasury, and Health and Human Services. This session was one in a series of meetings the departments have held with various groups of stakeholders, including the conversations held between the regulators and state insurance commissioners last month, and another that they held with insurance companies. The agencies are seeking ACEP and other provider groups' input on a series of detailed questions on key areas of the legislation. ACEP and EDPMA previously sent a joint letter to these same agencies that laid out our positions and recommendations on the major new policies included in the law. This listening session provided an opportunity for us to reiterate and expand on some of the points we made in the letter. You can read the letter on the ACEP Regs and Eggs blog and learn more about ACEP's advocacy efforts around surprise medical billing on the federal advocacy page on acep.org. The Biden administration released a portion of its fiscal year 2022 president's budget outlining the discretionary section of the administration's budget and policy priorities for the next fiscal year. This portion of the budget includes funding requests for agencies, initiatives, and programs across the government that are subject to Congress's annual appropriations process. The other part of the president's budget that was not released but is expected within the next month is the mandatory budget request, which reflects positions on programs already established and funded by law. There's no guarantee that Congress funds these budget requests, but they serve as a good marker for the administration priorities. Overall, the administration is requesting a funding level for HHS in fiscal year 2022 of $131.7 billion, which is a 23.5% or $25 billion increase over the current fiscal year 2021 level. Some highlights include a request for $8.7 billion for the CDC, which is $1.6 billion more than the 2021 level. This would be the largest budget increase for CDC in nearly 20 years. The administration believes that such an increase is needed to restore capacity to the world's preeminent public health agency. As well, $905 million for ASPR's Strategic National Stockpile to maintain replenishment of critical medical supplies and restructuring efforts initiated during the COVID-19 pandemic. $51 billion for the NIH, an increase that would be applied to continue to support research that enhances health, lengthens life, and reduces illness. $10.7 billion for states and tribes, medication-assisted treatment, research, and expanding the behavioral health provider workforce to help end the opioid crisis. $1.6 million, more than double the previous year's allotted funds for the Community Mental Health Services Block Grant. The request also includes funding to increase the diversity of the healthcare workforce and expand access to culturally competent care. Additional requests have been made for firearm violence prevention research, rural health access, and funding that would go toward improving care provided by the VA. As you likely know, last week, the U.S. Food and Drug Administration and the Centers for Disease Control and Prevention announced jointly that they were recommending a pause to the use of the Johnson & Johnson vaccine in order to investigate 6 cases of a rare and severe type of blood clot that individuals developed after receiving the vaccine called cerebral venous sinus thrombosis. The CDC's Advisory Committee on Immunization Practices then met Wednesday to review information on these cases. The committee decided it would need more information, though, to decide how to proceed and expects to convene again sometime this week. And just this morning, the FDA released highly critical findings in a report from their inspection yesterday of a Baltimore plant that earlier this month was forced to throw out up to 15 million doses of the J&J vaccine and had been ordered to temporarily stop all production. The violations, according to the FDA, included failure to properly disinfect the factory and its equipment, as well as failure to follow proper procedures designed to prevent contamination of doses and to ensure the strength and purity of the vaccine manufactured there. Last week, the CDC issued new guidance on the use of PPE, specifically N95s. This update came about through ACEP advocacy and includes information conveyed by ACEP members through our COVID discussion forum that encourages dialogue and information sharing between thousands of emergency physicians. In the guidance, the CDC acknowledges that the supply and availability of NIOSH-approved respirators have increased significantly over the last several months. In addition, the CDC stated that the number of reuses of N95 respirators should be limited to no more than 5 uses, or 5 donnings, per device by the same healthcare professional to ensure an adequate respirator performance. ACEP has scheduled its first of several meetings with CMS to discuss the MIPS value pathway, or the MVP, tomorrow. This CMS-supported emergency medicine-focused framework for quality performance reporting for physicians in Medicare will improve consistency and streamline reporting to drive quality improvement and contain costs. You can read about development of the MVP and the ambitious goals that ACEP has set to drive improvements to quality and care delivery for emergency care on the Regs and Eggs blog. We're getting closer to this year's Leadership and Advocacy Conference. Planning is underway, and we expect to have a robust program that will allow emergency physicians' voices to be heard on Capitol Hill. We're excited to get back together again in person. This year's conference was rescheduled from the normal April to July to allow time for COVID-19 vaccines to be more widely administered and for more time for travel planning and reductions on DC gathering restrictions. We're thrilled to offer you the opportunity to network in person again with colleagues who are also interested in advocacy and healthcare policy. This year's LAC includes an impressive and meaningful agenda that will focus on key issues, including lessons learned from the pandemic, opportunities to hear from officials in the new Biden administration, engaging with members of Congress and staff on policy impacting emergency physicians and patients, and a new town hall forum where you can sound off and hear from ACEP leaders on workforce issues facing emergency medicine and the future direction of ACEP. There'll be dynamic leadership programming and network opportunities as well. This is your chance to reconnect with your peers, advocate for your specialty, and engage with newly elected and longstanding members of Congress. We can't wait to see you in DC, and we hope you sign up. You can learn more at acep.org/LAC. So that wraps up this week's episode of Capitol Minute. As a reminder, this and all other episodes are available at acep.org/Capitol Minute. Now I'll be happy to take your questions. Remember, you can submit them using the Q&A feature of Zoom on the bottom of your screen. Got a question. What's the likelihood that the ED violence bill becomes law? How can we make sure this issue is addressed? That's a good question. So as I covered, the bill has passed out of the House. It did have some Republican support, so that was encouraging. The problem is that a companion bill has yet to be introduced in the Senate. We are working with several Senate offices to see if we can make that happen. But until it does, the chances of it becoming into law are obviously pretty slim because we would need the Senate to act on it. I know that historically Republicans have, for the most part, not been in favor of having additional OSHA requirements for any businesses, whether hospital or not, and I think that's been the sticking point for at least some Republican senators, and is a barrier that we're facing. So in order to make sure this issue is addressed, we've done a number of grassroots pushes on it, and thank you to all of you who did reach out to your members of Congress on the issue. And we'll continue to sound our voices on this. We are looking for additional stories of workplace violence to connect folks with the media on, so the media can kind of highlight how big of an issue this is, and hopefully that can spur further congressional action. So stay tuned for more. Got another question. So it says, thank you for supporting emergency physicians who have been challenged throughout the pandemic. Tax relief for PRF funds is important. Are there still opportunities to seek relief? There are still some opportunities to seek relief, and we highlight most of these on acep.org/COVID-19. There's a section there on federal guidance and as well as assistance. And I encourage everybody to check that out to see what is out there that you can maybe take advantage of. Another question was, how is the surprise billing listening session going? Does it seem like we will be able to see all of our priorities addressed? So the listening session itself, it was an hour and a half. There were a number of other physician groups on there, as well as quite a few hospital groups, various hospital associations. And I think we had a really good dialogue with the staff of the 3 departments who are working on the regulation, and we're able to provide them some pretty specific answers to detailed questions that they have. We plan to follow up with them with additional technical suggestions. That's something that they're seeking right now. One thing that is kind of to keep in mind is there's a pretty tight timeline on this. The first regulation needs to be released by July 1st. And then subsequent one, I think there's another one in October, and then the last one by the end of the year. And that's a really tight timeline for this kind of large or expansive a regulation to begin with. But a further challenge is, as I mentioned earlier, the CMS administrator has yet to be confirmed. And then that means that the head of CSIO, which is the Centers for Insurance and Oversight within CMS, also has not been finalized. And so without those political appointees, you have only the career staff within the departments who are working on this, and they are very skilled and experienced staff. This isn't any type of knock on them, but they are not empowered to make the big picture decisions that the political folks are. So they're trying to get as much work done as possible with the details, but without the kind of big picture pathway that only the politicals can set. I think that that is holding things up a little bit, and is probably one of the reasons why the listening session was kind of so detailed and technical in nature. So that's kind of where that's going. We continue to engage with other provider organizations. We have our specialty coalition, and I've been in touch with some of the hospital groups to see where we can align on big picture priorities and maybe all speak from the same kind of song sheet for some key issues, because I think that'll help us push back on the insurers who are, of course, doing the same activities from the other side. And we want to make sure we figure out as many ways as possible to limit ways for them to kind of game this new law to their advantage, because we want to make sure that emergency physicians especially have a fair level playing field in billing disputes with out-of-network patients, with out-of-network care. So that's kind of where that is. Another question is, will there be transcripts from the listening sessions made available? There actually will not be. The listening sessions, as we were told at the beginning, were off the record, also not for press purposes. So I don't expect there to be public transcripts of it. I don't know if there'll be summaries down the road, but I know that there won't be transcripts. I would not expect that. Let's see if we've got other questions coming in. On the budget, you mentioned the stockpile and lots of funding opportunities. Would you say the federal government is going to take a more serious look at pandemic preparedness moving forward? I think for the short term, yes, they are going to take a more serious look, but I would say just overall in government, there's a remarkable ability to have, I would say, short-term memory or longer-term memory difficulties. In the immediate term, after something big happens, you'll see lots of efforts for new legislation and new regulations to do it better or differently, or to avoid some of the mistakes that were made and kind of learn from our lessons. But those tend to kind of trickle off pretty quickly, and then you're left with just kind of a sense of fatigue on Capitol Hill and not wanting to revisit these things. And so then it becomes a lot harder to get everyone to pay attention. That being said, I think as we get more data in the long term and research on everything that's happened in the past year and a half with COVID, I think future kind of preparedness initiatives will be somewhat easier to make the case for, because we'll at least have data to point to from an actual scenario, versus up till now, preparedness has been, I think, a difficult one because it's all theoretical. Yes, everyone knew we could have, you know, a mass disaster event, catastrophe of some kind, or significant pandemic, but until we actually face the reality of the pandemic, I think that it was hard for some policymakers to really truly understand the need for all of these things and the urgency of it. Another question is, had the payer community had their session yet? Any surprises or big items that run counter to ours? I've heard reports that they did have their listening session, but I really haven't heard any feedback from it. Again, theirs was off the record as well, so the only way we would know what was said in it is if somebody that participated talked about it. So that hasn't happened with my knowledge, or at least nobody that I know has. So I don't really know how it went, but presumably it was similar to ours, and we'll have to see kind of what kind of arguments they make if they put out any public letters or responses to any requests for comments or proposed rules that are coming. All right, question. When does NEMPAC make decisions about who to support in 2022? So I think NEMPAC's already working on that. I think that's kind of an ongoing rolling process. We were putting together, I know, a scorecard where the NEMPAC, along with the NEMPAC board, they're part of the process of developing that scorecard. We assess candidates and existing members of Congress who are running for re-election based on a number of different criteria, including their voting record or kind of sponsorship on key emergency medicine priorities. And then based on that, then they decide whether or not to support a particular candidate in the coming election. So that's already ongoing now. And I believe NEMPAC will be putting out a report soon that can update everyone on where that stands. Another question, what's next with CMS and MVP after the initial meeting? That's a good question. I think CMS is we'll have the initial meeting. I suspect we'll have several more. If there are several more, I think that's a really good sign. But it's really encouraging that CMS wanted to meet on this. That means that they're working on it, and having an MVP that's specific to emergency medicine is really important because, as you all know, more than anybody, emergency medicine is pretty unique. And so the whole quality arena and pay for performance issues around it are a little different. And it's important to kind of not shoehorn in quality measures that are more appropriate for community-based care or primary care onto emergency medicine. So we're pretty encouraged to keep that momentum going after this first meeting. Last question. What are you looking forward to most about LAC? So I will actually not be at LAC. I'm getting married that weekend. So this is the 1 year, I think I have dispensation to skip it. So I am sad that I won't be able to see everybody the one time I finally get to catch up with everyone in the emergency medicine community in person, and I won't be able to make it. But I think what I'm looking forward to for everybody else who's attending is a chance for them to see each other and to engage, and then even more so to have you guys available for us to talk to members of Congress and convey our messages on key issues. Because as much as we can talk to members of Congress and their staff and tell them about everything that's going on with emergency medicine and your needs, it works a whole lot better when they can hear it directly from emergency physicians themselves. So I'm definitely looking forward to putting together a really robust program and some excellent resources for all of you to go talk to congressional offices on and really get our message through. So that's all for today. Thank you everyone for joining us, and we'll be back in 2 weeks, same time, same place, for the next Capitol Minute. Thanks again.